Welcome to Prestige Healthcare Services. At this time, I'd like to go through some of our Director of Clinical Services important pieces of information for orientation. The first piece I'd like to discuss with you is we have a program, software program called Access, and within it we have ability to document visits by way of our cell phone and smartphone. Technology has come a long way. Using the smartphone and the iPhone in terms of documenting our care for patients and having the ability for patients to sign in that the visit occurred, and a GPS system connected with that to have the patient's location be identifiable from wherever you are. It's a wonderful program. It's called Employee Visit Verification, and once you join on with us, we'll provide the link in Access where you can learn more about that. The second thing I'd like to discuss with you is HIPAA. HIPAA is a very important term. It's called the Health Insurance Portability and Accountability Act. It's a term we hear oftentimes, and we need to know the importance of what's behind it. So HIPAA began back in 1996 when legislation was passed, and the purpose of it is to protect patients' privacy. It becomes a very important consideration when caring for patients in home health. Only the people that need to know information should receive information about a patient. In other words, this should be information that identifies a person. Anything electronic, written, or oral needs to be only connected with healthcare providers working with the patient, the physician that's working with the patient, and only on a need-to-know basis. We take this very seriously at Prestige because your personal information is important, and it's not to be shared or taken lightly. So that is what we call the HIPAA aspect, and we will go through some more specifics about that with you as well. Another area that we want to talk about is incident reports. If you're caring for a patient and something happens, maybe they have a fall, maybe something happens with their medication, it's very important that we track that information, we write a report about that information, and that at an upcoming meeting of safety and risk, we discuss the incidents, we track it, and we learn ways in which we can improve that situation. When it comes to, for instance, a patient fall, we even take that a bit further. If a patient falls, we want to document it by incident report, we want to act on it, and we want to also consider the opportunity of having a physical therapy staff member be involved with that patient. We would get an order for a PT eval and assess the patient and see if there are ways we could improve that patient. So any incident needs to be tracked and reviewed. We also look at safety in the home as a very important aspect of care. We want you as the staff members to be very safe in the home. Your safety is important. We don't want anyone to be caring for a patient and feel that they're in danger of any kind. So we would connect with you, we would possibly offer security if that was needed, and we would offer you tips and techniques so that you'd be aware of your surroundings. It's always important to know where your exits are. It's important for you to know where you are in location of the home so that if you needed to leave quickly, you would be able to do so. All of these would also be, we would have a case conference to discuss the issues and learn better ways so that you could be safe and discuss possible situations with your physician and caregivers. So that becomes a very important aspect as well. So safety in the home is very important. You want to protect yourself, you want to protect the patient, and so forth. It's important that you are prepared. We even ask our staff at the time of an admission visit, look around the home, make sure there are smoke detectors, carbon monoxide detectors, and be aware of this, and also help the patient develop an evacuation plan. Should there be an emergency, should there be a fire in the home, you need to know how to escape quickly and how that the patient could escape quickly. So these are some of the things that we consider very important at Prestige. If a patient should require a medical social worker during the time of their care, we have that available. And what we would want to allow you to know is if you had a concern about your patient, whether it be safety concern, finance concern, housing concern, Perhaps the patient could display depression or suicidal ideation, or require crisis intervention, or even community services. These would be the specific reasons why you would obtain an MD order for an MSW or a medical social worker evaluation. The next steps that you would do in this case is inform the office with a communication note, include Debbie, myself, Ruth, Benedicta, our social worker, and include the reason and that you had obtained an order. And we will make that visit scheduled for Benedicta, the social worker. So then Ruth would schedule the visit, and then Benedicta would go ahead and see the patient, and then for any further orders she would contact the physician office as well. Let's see another area we need to discuss. Okay. Professional boundaries. This becomes a very important concern in home care. When we care for patients in the home, we can become very comfortable with caring for them. We can almost feel that we're family members. Well, it's true to a certain extent that you allow a comfort feeling, a feeling of respect for one another, and a trust develops. But always remember, when you're caring for a patient, you must maintain your level of professional boundary, which means that you are the nurse caring for that patient, and you must have a separation for keeping your professionalism at all times. That also goes along with the HIPAA concern as well. The other aspect I wanted to talk about is content of communication. When we write a communication note or any of our notes in the documentation system, we have to be very factual and objective. Appropriateness of the information that we're communicating needs to be very specific, and we actually have a form of communication that I'd like to share with you right now, and it's called SBAR. What's SBAR? SBAR stands for Situation, Background, Assessment, and Recommendation. It's actually a way of thinking and communicating that allows you to be very specific, and you condense your thoughts both in speaking to a physician and also in communicating what information you need to pass along. The situation could be that there's poor communication, errors, callbacks from clinician and clerical staff to get more information. You want to have that very clear. What is the situation? What is the background? What is behind what it is you need to communicate? So you need very specific communication style. You need to be following a hierarchy, use the aggressiveness you need, and be free of distractions. Assessment. We need this assessment to be very specific and professional, especially if it's from a clinician. And the recommendation is a simple tool shown to effectively improve communication that will decrease error and has been effectively applied to healthcare. So these are some of the very specific tips that we offer in terms of providing that communication as clearly as possible. So once again, SBAR. Situation. State your name, your agency, what you are calling about, who you are calling about, and the problem that you are calling for. Background. State the primary and pertinent diagnosis and the date and the admission to the agency. Relate the complaint given by the patient. Pay special attention to the emotional, mental status. List the current medications, allergies, most recent vital signs, most recent lab results or treatments. Assessment. Give conclusions about the situation. Words like might be or could be are helpful but not necessary. Relate how severe the problem might be. And it could relate to things like weight, neuro changes, musculoskeletal changes, blood pressure, temperature, respiratory changes, pulse, blood sugar, pain, wound, GI or GU factors. And recommendation, say what you think would be most helpful or what needs to be done. And this will help you formulate your plan and help you communicate effectively with the physician and going forward. I have just two more things to go over in terms of nursing care that are very, very important. One, hand washing. Now, you've heard that hand washing is very important in preventing infection And it is so key in healthcare and in home care as well. Therefore, we have policies on hand washing and also nursing bag technique, which we'll specifically go into when we begin working with you. It's very important to realize that cleansing your hands when you see a patient, before you see the patient, before you leave the patient, and then anytime you're going into your nursing bag, you need a clean side, you need a dirty side, and before you enter that clean side, your hands must be clean, and anything you place into that clean side must be clean. So these are, we'll definitely provide you the complete handout for it, but I want you always to think in terms of how important hand washing is. Even something as simple as you wash your hands, you use a towel, and then you go touch the faucet. You've just contaminated your hands. You have to use the paper towel to shut your faucet off. So there's very specific things we'll go through with you on that regard. And then nursing bag technique also becomes a very important aspect. Where you place your bag in the patient's home, always use a barrier before you place that bag down on a patient's furniture or any of their table, their chairs, whatever. And also, or you could hang the bag on the end of the doorknob. But always, always be cognizant of where you're putting things and your use of clean hands, clean supplies, and how that affects the patient. And then when you leave the home, wash your hands before you leave so that you won't bring anything from the patient to the exterior world. And that's all I have for today. I thank you very much.